So, hi, this is Danny with Longevity for the Long Haul, and this is Katie. We're members of Any Action. We're volunteers. We just attended a town hall that they hosted with a bunch of great speakers to kind of give us insight and inspiration on what's coming and just the many different things that we're going to need to be involved in, moving forward. So, wow, it was such a awesome town hall. What did you think?
Um, I was overwhelmed. I actually had to like step away for a moment because I was crying, come back. And the part that hit me so hard was people on, I get it. With every system, there's going to be people that try to take advantage of that, right? Any system in place.
hmm
And we assume that that's the majority, but it's not, right? It's just like you have a lot of assumptions about chronic illness and what it looks like and what it looks like when people are on disability and they can't work. I had a lot of the same assumptions until that was me.
hmm
So what hit me hard was the medic Medicare, right?
hmm Yeah.
Um, or Medicaid, I should say, the Medicaid. And the reason being is because I'm on Medicare and I'm only on Medicare because I'm on Social Security disability and I
hmm
have private disability as well. So
hmm
what that means is I worked, I paid into Social Security, I paid into a private disability company, and then I got sick. And after 20
mm
years, 28 years, I was able to tap into my disability. They forced me to apply for Social Security. And when they did that, they were then able to pay me less depending on what disability paid me. So I went down to a fifth of what my income used to be. So I say all this because I know how hard it is for me to pay my mortgage and pay my utility bills, get food, pay my medication, and hospital bills.
Yeah. And I mean, even if we stick with the Medicaid and Medicare and understanding like that hospitals rely on Medicare and Medicaid to like stay open. And so people are like,
Yeah.
why will this affect me? And it will affect everyone. And
Yeah.
I remember way back in the day when Obama passed the legislation and it's switched, the hospital was open with 1 cent on the dollar when it had been 4 cents on the dollar. And we had to double up on workloads and things like that. And people are blindly thinking the worst about other people who are living with the need for Medicaid and Medicare. And if we get rid of it, they don't realize those of you that don't have insurance, that are not disabled, but go to the hospital if they break an arm or if they have an emergency and they don't carry insurance, like there's going to be nothing for you. There's going to be nothing. And I think that's what people don't realize. If they think this is just to give somebody else a leg up, no, this is about all of us. And like, it's just crazy.
It affects everybody, and people don't understand. You can't live in isolation from other people. Like, there is no such thing as I pay my taxes and I pay my insurance, so I'm good. That's not the
hmm
way the world works. And so there are going to be millions of people who won't be able to get health care. There's going to be hospitals that have to close. There's going to
Yeah,
be people,
small towns are definitely they're gonna
yeah, small
rural
towns, yeah.
areas. Yeah,
Yeah,
they rely
those
on it.
places, yeah, those places that still have, small town doctors that you can
hmm
call in the middle of the night if you need help. There are physicians that do exist out there that still have that uh, fundamental, like, belief in it is the healthcare of the people, right? Providing healthcare for the people regardless of the cost and regardless of what that's going to mean for them, meaning they might not even get paid, but they're going to save a life. And making all these cuts haphazardly, and I probably should educate myself more to find out if there's more that, you know, is to come. I'm sure there is, but I feel as though it's haphazardly done. I feel as
Yeah.
though these cuts are
Well, this is
coming.
just like a broad stroke. It's like a broad stroke, and it's like they pick a fight, a big fight, and then they go for their intended target, which we don't really understand what that target is. I mean, just to close this segment out and keep it nice and short and sweet, we need to fight for Medicaid and Medicare, and we can't afford to have these cuts. No one can afford to have these cuts because you never, like, you could be us on any given day because you didn't know the day that you got COVID, that would be the beginning of the end, the last day you were able to have the freedom to choose how you wanted to live, what you wanted to do. And if it weren't for that type of support, you wouldn't be receiving healthcare today.
No.
So, yeah. And you got COVID just like I got COVID. So
Hmm.
to close it out, what do you want to say to people? I mean, I think what we should do is we should include a link in this
Hmm.
post to teach them how to contact their representatives. If you're shy, you
Hmm.
don't want to contact your representatives, don't know what to say, you can call after hours or you can call on the weekends and just leave a message because those people that are working in those offices are tallying up your card, like tallying up your call, like if you are for or if you are against. And then our representatives will go and vote based on what their constituents say. And it does matter, and it's super simple. So we're going to include a link into this post where you can find your representative. Maybe it's too late for you to call today about Medicaid, but there's going to be other opportunities for you to call in order to reach out to your representative and just let them know what you did vote for. I mean, we can't really even make this a bipartisan, not a bipartisan, but we can't make this a Republican Democratic
Yeah.
thing. We just like you're voting for the issues, you need to vote, you need to speak up on the issues and let them know what you voted for so then we can at least have a little stability for our neighbors, for our friends, for our family, and for our community.
Yeah. And the squeaky wheel definitely gets the grease. So
Yep.
if you keep calling and you keep writing and you keep signing petitions and, you know, coming together, then you're going to be heard. It's going to happen. We have to have the numbers. We have to have people that are as passionate. And please don't wait till you get sick because you don't know when that time will come, if it will come, or a loved one. You want to take action now while you're able to.
Yep. Okay, so this is Danny.
I'm Katie.
And tune in for more and follow us for more information like this in the future because we're going to be showing up and telling you guys what we're learning and how you can participate and be a part of the change that we need to see moving forward. Thank you for watching and tune in again and follow us on Longevity for the Long Haul. And you can follow Katie on Katie Gatsby on Instagram and I think Facebook. But anyways, we're just getting started and we really need your support moving forward. And we just want you to reach out to your representatives and tell them what you did vote for. And we'll see ya. Thanks.
Bye.
Bye.